Hi everyone, I'm Dr. Lee Andersen, attending physician and medical director at Mill Creek Care Center and ALC hospitalist at the Royal Victoria Regional Health Centre in Barrie, Ontario. It goes without saying that we've all faced huge challenges this year due to the COVID-19 pandemic, but we finally have good news with the availability of the first COVID-19 vaccines. These vaccines will allow us to protect ourselves and those around us and help turn the tide on the pandemic. However, it's quickly become clear that many people have questions and concerns about the vaccine, and I hope to be able to address these in this presentation. I'll be focusing on the mRNA-based vaccines produced by Pfizer and Moderna, because these vaccines are the first that we have available. To start with, I'm going to talk about some basics about cell function and viruses so that we can understand better how the mRNA vaccines work. This is a diagram representing a cell in our body. Inside the cell is the nucleus containing our genetic material, or DNA. As part of the regular day-to-day functions of our cells, the DNA is replicated and strands of information called mRNA are produced. These strands give the instructions to our cell on how to do various things like make proteins. So the machinery in our cells read the mRNA and produce proteins, and then the mRNA is degraded. It doesn't persist in the cell, and it doesn't go back into the nucleus or back to the DNA. This represents a virus particle. The blue squiggly lines inside represent the genetic material of the virus, or RNA. On the outside of the virus, there are proteins, which allow the virus to attach to our cells, and the viral contents can enter the cell. So with any usual virus, such as the common colds, flus, stomach flus that we're all frequently exposed to, the virus enters the cell along with all of its genetic material, or RNA. Once inside, our cell starts replicating that and creates mRNA of the virus, which then gives the instructions to the cell to produce viral proteins and then eventually produce entire viruses, which are then released. And this, with the usual viral infection, is what happens. The viruses enter, along with all of their RNA, produce copies of the RNA into strands of mRNA, and then produce proteins and entire viruses. Our body then recognizes those viruses and produces antibodies and other immune responses, such as T cells, which help to fight off the infection and give us immunity. In the case of an mRNA vaccine, we have strands of mRNA contained in a lipid capsule, and that mRNA is the instructions on how to make the COVID spike protein. This then enters the cell, where our cell reads the instructions on the mRNA and goes ahead with producing the COVID spike protein. Once that is done, the mRNA is degraded and the proteins are released. The mRNA never enters the nucleus and does not have any effect on our own DNA. The cells produce the spike protein and release it, Then our body recognizes that foreign spike protein and produces antibodies and other immune responses that give us immunity. So just to summarize, we are exposed to the entire viral RNA every time we have a common viral infection, such as a common cold, flu, or stomach flu. The entire viral RNA enters our cells, and our cells turn into virus factories, replicating the virus in large numbers. And this is a normal viral infection. Our immune system recognizes the foreign virus, and it fights the infection and gives us immunity through production of antibodies and other immune cells. In the case of the COVID mRNA vaccine, the vaccine contains specific mRNA from the COVID virus, which gives the instructions on how to make the spike protein, which is found on the surface of the COVID virus. When the vaccine enters our cells, the mRNA is read by our cells, and the spike protein is produced and then released. Our immune system sees the foreign spike protein and responds, creating antibodies and other immune cells, and then giving us immunity to the COVID virus. The mRNA from the vaccine is degraded once the spike protein has been made. It doesn't persist in our cells, and it has no effect on our own DNA. So hopefully that information answers one of the most common questions that I've heard about whether the mRNA virus can have any effect on changing our own DNA. And the answer is no. The mRNA virus does not have any effect on our own DNA. So the mRNA COVID vaccines that we're talking about are made by Pfizer and Moderna. The studies have shown that they're very effective, in the range of 94 to 95% effective. And in fact, the immune response that we get from the vaccine is actually stronger than the response from having COVID infection itself. Many people are also concerned about the possible side effects of the vaccine. The side effects would include local pain at the injection site and sometimes swelling and redness at the injection site. After the vaccine, people may also notice muscle aches, fatigue, headache, sometimes fever and chills. These types of side effects are common with other vaccines as well, and not specific to the COVID vaccine. In general, the elderly tend to have fewer of these side effects. This is a table that I took from Dr. Jessie O'Shea on Twitter, and it shows all of those side effects and compares the Moderna mRNA COVID vaccine, the Pfizer mRNA COVID vaccine, to the flu vaccine, and to Shingrix, which is the shingles vaccine. The table shows the rates of these different sorts of side effects, and overall, we can see that the COVID mRNA vaccine side effect rates fall somewhere in between the flu vaccine side effect rates and the shingles vaccine side effect rates. We can also see that in general, the Moderna vaccine looks like it has slightly higher rate of side effects than the Pfizer mRNA vaccine. So who can take this mRNA vaccine against COVID? The studies included people with various different medical conditions, And people of all ages were also included in the studies, ranging from 16 in the Pfizer studies or 18 in the Moderna studies, up through to the elderly. So people with all different medical conditions as well as all different ages are appropriate for this mRNA vaccine. Studies including children are currently underway, and hopefully soon the vaccine will also be available for children. Studies including pregnant women and breastfeeding women are also coming. It's usual for pregnant women and breastfeeding women to be excluded from initial studies, so this is normal. But based on how the vaccine works, most experts believe that the vaccines will be found to be safe for these populations as well. I also had some questions from women of childbearing age who may be planning for pregnancy, and the vaccine does not have any effect on fertility and would not have any risk for future pregnancies. So it would be safe for women who may be planning for future pregnancies. There are also some questions about people who may have autoimmune conditions or immune suppression. So as usual, the vaccine studies did not include people with these conditions. Based on how the vaccine works, most experts believe that the mRNA vaccines would be beneficial for people with autoimmune conditions or people who have immune suppression, but the vaccine may be a little less effective for these people. And exactly how effective, we don't know yet. So having an autoimmune condition or immune suppression does not mean that you can absolutely not receive the vaccine. And in fact, the vaccine could be appropriate and should be considered case by case, and would be a good idea for people to discuss with their healthcare provider. The vaccine, based on how it works, does not cause infection, does not contain any virus, and so would be safe for people with immune suppression. It just may not be as effective if the immune system isn't able to mount the same response to the vaccine. For people taking blood thinners, the vaccine would also be safe. Because of blood thinners, there may be an increased risk of some minor bleeding or bruising secondary to the injection, but in general, the benefits of the vaccine would outweigh the risks. There have been some reports of people with a history of serious allergy having allergic reactions to the vaccine, and it is noted that there is the possibility of an increased risk of allergic reaction for people who have a history of severe allergy. That said, having a history of allergy doesn't mean that you can't receive the vaccine, but the risks and benefits should be discussed prior to a decision being made. However, if you have a known allergy to an ingredient or component in the vaccine, or if you did have an allergic reaction to the COVID mRNA vaccine, then you should not receive a dose of that vaccine. The ingredients in the vaccine are actually quite simple. The mRNA vaccines obviously contain the mRNA, which gives the instructions for the COVID spike protein. They include lipids, which form a capsule around the mRNA and allow it to enter our cells. And they contain electrolytes, sucrose, as well as acetic acid and tromethamine for the Moderna vaccine. And these ingredients are all to help stabilize and maintain the appropriate pH of the vaccine. Some people are concerned about other vaccine ingredients such as aluminum, mercury, or formaldehyde, and the mRNA vaccines do not contain these ingredients. The COVID mRNA vaccines are given as injections into the muscle of the shoulder. They're given as 2 separate doses, 21 days apart for the Pfizer vaccine or 28 days apart for the Moderna vaccine. And approximately a week or so after the second dose is when the maximum protection is seen. The Pfizer mRNA vaccine requires very cold storage at minus 70 degrees Celsius, so it can't be easily distributed to places like nursing homes or smaller communities. The Pfizer vaccine, however, is currently available for long-term care staff in our region through the immunization clinic being run by Royal Victoria Regional Health Centre in conjunction with our public health unit. The Moderna vaccine will be easier to distribute as it doesn't require the extra cold freezer, and it's expected to be available for long-term care residents in January of 2021 and should be available through the health unit and can be distributed to the long-term care facilities themselves. Some people also have questions about how rapidly the vaccines were developed. And there are various factors that allowed for that rapid vaccine development. One, mRNA technology had already been developed and had been used for various cancer treatments. And the mRNA technology is a more rapid way of developing a vaccine. So that was helpful. Coronavirus studies had already been underway to better understand coronaviruses, looking for opportunities for vaccines. And so the COVID virus, being a coronavirus, was already partially understood, and that helped. Obviously, in the setting of a global pandemic, there was a very focused effort worldwide. Efforts for vaccine development were given priority and funding. And that all helped greatly as well. Throughout this, the same processes were followed in vaccine development, the same studies, gathering evidence, gathering data on safety and efficacy, and the same approval processes were also followed. There were no shortcuts or skipped steps. That's all the information that I had prepared. Thank you very much for taking the time to learn more about the COVID mRNA vaccines. I hope this helps you in making your decision. Stay healthy and all the best for 2021.